What do y'all think it's made pharmacists kind of step out of their comfort zones and do that's different than before?
I mean, I think the easy one is it accelerated their pace of change to a point where they just had to do something. There's been a lot of kind of stagnant, well, I'm always worried about DIR fees, or I'm worried about, the big bad wolf down the street at CVS. This brought out, hey, if I don't change something, I can't physically open my store. So I think the clock on innovation just got accelerated by probably years.
Well, what do you think some of those things are?
I mean, I think we're going to see pharmacists fill positions like nurse practitioners and PAs did in the late 90s when there was a huge primary care physician shortage. We still have that shortage. We have a bigger need of people to get healthcare, and pharmacists are on every corner. They're open. They've been providing good advice for a long period of time. So in addition to things like curbside and drive-thru, I think you're going to start seeing pharmacists doing point of care testing, probably getting paid to do point of care testing. And frankly, probably doing some additional medication management services, because where people are sick with coronavirus going to the hospital or the ER, you've got pharmacies that can now provide those same types of primary care services at that point. So I think you're going to see pharmacists take a step into primary care med management more than just straight up dispensing.
I would even say it's even like had that a little bit of that impact on the consumer, right? You get people now, like just regular people I've talked to that I know in my circles too, that are like, maybe the pharmacist can do that. Where they were getting out and trying to think about, how do I get a test? Who do I talk to about telehealth or whatever, or I'm feeling this way or something like that. I think you're even getting more people than traditionally who already feel that way. More people that didn't typically feel that way kind of go, maybe my pharmacist can do this, or maybe they have a way of getting to that.
I mean, if you look at it, like in 2008 when I graduated, very few pharmacies did flu vaccines. Now it's kind of crazy if a pharmacy doesn't do flu vaccines. So things like that, where you've got, I can go to the pharmacy and get my A1C checked, or I can have them, pop into a telemedicine group and get my blood pressure checked, or ears, throat, things like that just would have seemed bonkers 5 years ago, now suddenly seem like a great idea.